Good evening, everyone. We're excited to welcome Karla Palacios-Reagor, a certified therapeutic recreation specialist at Scottish Rite for Children in Dallas, Texas. Karla graduated with both a bachelor's degree in kinesiology and a master's degree in coaching, sports, recreation, and fitness administration from Angelo State University, where she also shined as a 4-year track and field athlete and a part-time personal trainer. She's now worked in the field of therapeutic recreation for almost 10 years and enjoys educating children and their families on how to incorporate recreation and leisure into their lives in a way that's adaptable for various needs. Please join me in welcoming Karla today. Karla, the floor is yours.
All right, good afternoon, everybody. Sorry, sorry, my internet isn't always friendly. Can you guys hear me? So a thumbs up would be nice. And just to help my internet be nice, I'm gonna leave my camera off. Okay. Okay. Well, thank you, Elizabeth, for that wonderful introduction. Thank you, everybody, for having me here. I am very excited to be able to share my experiences and my knowledge in therapeutic recreation in the field of children's orthopedics. My goal here today is to help you guys understand about our field of work in therapeutic recreation and also how we assist our patients here at Scottish Rite. And although we do focus on children's orthopedics, I hope that you are able to utilize some of this information in the future with any age group. Okay. So just a little bit about me. Ms. Elizabeth did a wonderful job at introducing this part, but yes, I did go to Angelo State University. I do have a master's in coaching, sports, recreation, and fitness administration, and a bachelor's degree in kinesiology. I became a certified therapeutic recreation specialist in 2019. I have been working in behavioral or psych hospitals for about 5 years before working here at Scottish Rite. And I am really blessed to be almost 3 years at Scottish Rite in December. Two behavioral health and orthopedics, two different populations. But I do believe that therapeutic recreation is essential for both of these populations. You can find therapeutic recreation in other settings, like in parks and recs and schools. But I would definitely say that recreation therapy is mainly utilized in behavioral or psych hospitals, and orthopedics or rehab for physical and or cognitive delays or disabilities. Okay, so what is therapeutic recreation? Thank you for asking. So textbook, the purposeful and careful facilitation of quality leisure experiences and development of personal and environmental strengths, which lead to a greater well-being for people. And who can benefit from TR? Individuals who, due to challenges such as illnesses, disabilities, or other life circumstances, need individualized assistance to achieve their goals and dreams. Recreation services, they are about providing recreational resources and opportunities to improve health and well-being. In my own words, guys, I think therapeutic recreation is good for anybody. I don't think you really don't need to have an illness or a disability or a life circumstance that may happen, but I think it's good. It could be viewed as self-care, using leisure and recreation activities to help balance your life, work, family, lifestyles, finding an activity or a leisure activity that's going to help you stay sane, stay happy, stay healthy, find well-being and good balance in your life, both in your body, mentally, physically, spiritually. And I'll break that down more specifically on the next slide. but some other benefits for TR is it helps increase independence, self-esteem. It helps help an individual work towards a healthy lifestyle. It helps with developing social skills, making friends, gaining a sense of belonging, improve physical functioning, reduction of secondary disabilities, that's a big one, and or improving coping skills or adjustments to disabilities. And here's a picture. This is one of our groups that we were hosting here for our inpatients, and in the back of the blue shirt, that's my awesome coworker, Nicole. All right, next slide. So here I'm going to break down therapeutic recreation into 5 domains. So there's physical well-being, psychological well-being, spiritual well-being, social skills well-being, cognitive skills or well-being. So these domains pretty much breaks down how therapeutic recreation can be used. The domains could be break down as they can also be known as an intervention or the goal or the care plan. So if a person is working on the care plan or their goals have to do with physical well-being, then we focus on the physical well-being domain. In this domain, participants work towards improving their physical health to be able to participate in their daily life with little to no physical barriers. And I highlighted this one because this domain is one that we touch more here at Scottish Rite as an orthopedic hospital. The second domain is psychological well-being. Participants work towards feeling happy or satisfied and perceive control in their lives. Sometimes we use this domain at Scottish Rite. This domain is mainly used in psych and behavioral hospitals. TR can be used to help cope with anything that's going on in a person's life. For our kids specifically, we can use TR as a positive incentive for kids to reach other goals, such as maintaining, staying on their traction, on a hill attraction, or going to their PT sessions, their OT sessions, taking their medications. Sometimes the kids come and they don't want to do these things for whatever reason. They have anxiety or fear. They don't like hospitals, or they're tired of coming back and forth, but they love TR. They love recreation therapy. So we can use therapeutic recreation to help them maintain a positive effect while at the hospital, but also work towards other skills, other goals. So psychological well-being domain, an intervention or this goal used at Scottish Rite would probably be like a secondary goal to our kids. Our primary would probably be a physical well-being or physical skill. But if that physical activity that we are offering also makes them happy, then it also becomes a psychological well-being domain or goal. The next one, number 3, spiritual well-being. This one we also don't touch base a lot here at Scottish Rite. We do have a chaplain, a chaplain and a deacon. A chaplain. And she does this part. She prays with the family. She offers services, spiritual services for the families, and services. God's play. So we don't need to touch base on this one a lot here. But I have used spiritual well-being in psych hospitals, behavioral hospitals, and we're focusing on this domain through therapeutic recreation. Participants works towards living their lives in a hopeful manner, in harmony with their values and beliefs. So if someone, I think the best example I can give is when a person who is under suicidal ideation and nothing motivates them to continue living life, or nothing makes them happy, but they do find peace in reading the Bible, going to Bible study, talking about their religion, then we can use this domain in therapeutic recreation through writing about it. Like, provide you with a book. A book is the Bible. Here's a Bible you can read. Here's a journal you can write, and I'm here to talk if you want to talk. And so that's how we can use spiritual well-being and therapeutic recreation to help maintain, a satisfaction in life and give them a motivation to keep on going. So if religion or having a higher hope is what motivates an individual to keep going in life and reach for their goals, then this is the domain that we'll stick with. Number 4, social skills or social well-being. I also highlighted this one because this is one that we use a lot here at Scottish Rite for kids who have cognitive delays or developmental delays, or are even nonverbal. We do have a pediatric developmental clinic, developmental disability clinic, and we do see kids with like autism who may be nonverbal, or kids who are here for orthopedic reasons, but they have a secondary symptom or diagnosis that has to do with their speech or any type of delay. So we would get referrals from the physicians from those clinics, and they want us to help the kid participate in community, be more social, outgoing, make friends. So if a person is working on social skills through therapeutic recreation, the participant attempts to relate well to others and belong to valued social groups. And we can incorporate this domain through team sports, the book club, doing therapeutic recreation groups, or even one-on-one sessions, anything that will help the participant increase social interaction, or decrease anxiety of public speaking or just making friends. Number 5 is cognitive skills or cognitive well-being. Participants work towards thinking and learning in a focused way. So this one kind of goes hand in hand with the social skills. With the cognitive skills well-being, we can use reading, writing, problem solving, like board games, learning how to ride a bike, playing sports, so you have to follow rules, follow step-by-steps in order to be able to be successful at that sport. Riding a bike can help you with if you have a short attention span, you really have to focus on, looking in front of you, not looking away, because you may crash. So we can use recreational activities to work on cognitive skills. Next slide. So how does a CTRS evaluate and treat? So here is the process that we do here at Scottish Rite. It's very generalized. You would see the same process in other facilities, but for sure we do it here at Scottish Rite in our therapeutic recreation department. The first thing we do is assess. So we assess the kid or the patient to learn about their abilities, their interests, and or their needs. Next, we want to develop some goals based on what we've learned from the assessment. We create a care plan to work towards those goals and then implement the interventions. The interventions can be an individual one-on-one session or a group intervention with other kids. The next step is we document our process, but you don't chart it. It didn't happen. Just kidding. But yes, you do need to chart, sometimes it's for insurance reasons, but we do it for maybe that reason, but mainly because it helps us keep track of any change that's had happened to that with a participant during their interventions. We want to know whether it's been good, whether it's been bad, whether there's been any change. And then we want to evaluate as needed or until discharging from therapeutic recreation services. At Scottish Rite, in our department, we discharge once the patient or the individual and or the family are educated enough to be able to proceed these services, or not services, but activities independently. So if I see you to show you how to exercise or how to play basketball seated, or how to ride a bike, I'll see you a few times, and then my goal is for you to be able to do that on your own. And so that's what we do here at Scottish Rite. We educate, and then we encourage them to be independent. In other places, with other TR services, you'll have like contractors, for example. They can continue doing TR services long-term and continue to work on that goal for as long as that patient needs it, or as long as the family wants it, and it can just be long-term. All right. So it takes, therapeutic recreation at Scottish Rite for Children. So more specifically, we offer inpatient care. We have outpatient care, and we also have community outreach programs. For our inpatients and our outpatients are very similar, except, the difference is our inpatients are admitted at the hospital and the outpatients are not. We see them in our clinics. So We do require, for inpatient and outpatient care, we do require providers' orders before we see them. And then we do that process, evaluate, we set goals, and then we do the interventions. And only at this time, we are only offering group sessions to our inpatients. And I'll show you more about that on the next slide. For our outpatient care, right now, we only offer them either community outreach programs or one-on-one sessions. We also provide both the inpatient and the outpatient care community leisure resources. So again, our goal is always for them to be independent in the community. And if they need some extra education, then we would offer the one-on-one sessions. Like, hey, let me introduce you to volleyball one session, the next session we'll do basketball, the next session we'll do dance, and we'll figure out what it is that they're interested in, and then connect them into the community so that they can continue doing that on their own. So for community outreach programs, those are programs that we offer here at Scottish Rite. They are implemented by the Therapeutic Recreation Department, and they are only for Scottish Rite patients. For participants or for patients to participate in community outreach programs, you do not need providers' orders. Families are self-selected. We have flyers if they want to join in, that is great. They just have to be a Scottish Rite patient. And here are some of the conditions that Scottish Rite works with the kiddos. So we specialize in scoliosis and spine, limb lengthening and reconstruction, hand conditions, clubfoot and foot disorders, hip disorders, and sports medicine. There's some other treatments that we offer, like psychology, rheumatology. So these are just like the baselines of the diagnosis that we offer or that we take for Scottish Rite. We also have a dyslexia department. Okay, next slide. So therapeutic recreation and patient care at Scottish Rite. So here I put a group calendar so you can have a visual of what we offer here at Scottish Rite for our inpatients. So like I said, only the inpatient kiddos receive group interventions. So again, we get the referral, we assess them, and after we assess, we decide whether the kid would be appropriate for group or if they would benefit from having an individual intervention. If we do decide that they can go to group, here is the schedule that we pass out. This was one from July. We offer group 3 times a week, Monday, Wednesday, Friday for an hour. And we give them this calendar maybe like the last week of the previous month to give them a heads up of what to expect. And I can give you, and this is where you can learn some of the activities that you can offer to someone who needs or wants adaptive recreation and or leisure. We see Monday the 1st, we have a game that we call Tally Ball. And that's basically, we're using a beach ball, a pickleball net, and tennis rackets to play volleyball. So the kids are allowed to use their hands, the racket. Sometimes they even want to use their feet. That is okay. We adapt as we need every time the kids come in. We have ambulatory kids, we have non-ambulatory kids, kids with missing limbs, kids who are a little fragile because they are just getting out of surgery or they're getting ready for surgery. They are very capable of coming to group. We just adapt as we need to. They love this game, Tally Ball. We either play for points or we play just for fun. It really depends on the group that we have and their personalities. And our goals for them is usually to increase physical activity, maintain physical activity, interact with others, increase or maintain social interaction, and also keeping them busy, not busy, but having a healthy routine at the hospital. We don't want them just sitting in their room, they're children after all, and our model is give the children their childhood back. And that is our goal here at Scottish Rite. Another activity, we see Wednesday, the 3rd, we had a Jeopardy. The theme was USA since it was 4th of July on that Thursday. When we offer Jeopardy, we don't really do a lot of board games because we like to offer physical activities to our kids. And the reason is because we have a child life department, and our child life department offers arts and crafts, video games, board games, seated, calm activities. Um, and if our goal for our patients as a therapeutic recreation specialist is for them to be physically active, we're not going to have a lot of board games. When we do have board games or arts and crafts projects, it's either for a special request because it's a holiday coming up, or we adapt because the group that we have, they're either tired or um, they just recovered from surgery or they're getting ready for surgery. We adapt as needed. Anyway, we have Jeopardy on this day. And the topics were USA, and we connect our laptop to a TV screen and we have a ball. We have a great time. Every Friday we do have Free Choice Friday, so we can give the kids some autonomy and say, hey, this is your group. You help us plan it. Here are the activities that you're going to choose. We get together and we agree on a Wednesday before the Friday what we're going to do on that Friday. And it helps them stay motivated and give them a sense of independence. They're helping make choices for their care plan. And with that being said, they actually do help us create the group schedule for the next month. We sit them all down and we ask what is a sport that you want to learn, or what's a sport that you do like, or what's a game that we played in the past that you want to see again, or what's one game that you want to avoid altogether. So we do create these group schedules with the kids, again, to give them autonomy and work on decision making, and remind them like, hey, this is your group. We also play bocce ball, basketball. We play gaga ball with a twist. Tennis, floorball is like it's soccer but with hockey sticks. Family Feud, aim game, and golf. And all of these sports, again, they're all adapted based on the child's needs, abilities, wants. Um, and sometimes we will have a kid who's either afraid or they think they can't because they've never tried it. And their parents may think the same thing. Like, we go in there, we tell them what we do. Hey, we're gonna play basketball on Wednesday, and the parent and family, if they're new, sometimes they'll look at us like we're crazy, and they'll say, no, they can't. Can't you see they're in a wheelchair? Or can't you see they're on a traction, or they have a cast? So when that happens, we speak up and we say, well, actually they can. Let us show you how. So while they are here at Scottish Rite, another goal is to educate them on increased knowledge of adaptive leisure activities or recreation. So they learn how to be able to play, participate in these activities with their conditions, whether it's with a walker or the wheelchair, or they have a condition where their bones are fragile, they can't move very fast. I believe that almost any activity can be adapted. And if there's an activity that they can't do, that is okay. There's other things to do. We don't have to stick to that one thing. We'll find something that will fits you. And if they are afraid to try something new, we actually encourage them to try it first. We don't force, but we do remind them like, hey, therapeutic recreation, it is part of your care plan. And although it may seem like it's optional because it may be recess to you, here are the benefits that you're gaining from it. And you have to continue coming because we do have doctor's orders and we have a specific care plan for you. And we also we educate the parents, and we hope that they also help advocate for us for the kids to be able to come, and not advocate but encourage their kids to continue coming, because some kids, they're here long term and they get, like, we call it senioritis, like they're just ready to go. But we always encourage everyone who we get referrals to come to group, and we'll find a way for them to participate or enjoy it or adapt it. But at the end of the, when they're ready to discharge, they always learn something. They're very grateful. And a lot of the times they will continue with sport that they learned here at Scottish Rite outside of their, outside in the community after discharge. And that tells us that we accomplished our goals. So that's group. We do have a tennis court outside. We have a bocce court or field outside. We have basketball courts outdoors. We have an adaptive playground. We have sidewalks where the kids could go on walks or strolls. We have an indoor solarium with a basketball hoop, some basketballs, balls, soccer balls, a soccer goal. We have a video game consoles that we use. We have a Nintendo Switch where we can play sports like the Wii Sports, but like on the Nintendo Switch. We are very lucky to have those great resources from Scottish Rite, and we are able to provide those activities and resources to our kids and be able to introduce the activities to the families in person and not just talk about it, but actually show them um, with the resources that we have here. So if we do have an individual intervention for an inpatient, the reason why we wouldn't have them join in group would be one, they're bedbound, they're in isolation, they cannot leave their room. Some kids are in clinitron beds, which means they have a really bad wound somewhere in their body, usually on their buttocks, and they can't leave the room because they have to stay on this clinitron bed. But they're here for long terms. They're here for like 4 months at a time, and we hate to think of our kids having to be in that room for 4 months and not being able to leave. So we get TRs or orders. When kids are bedbound and they can't leave their room, one of their goals is to maintain a positive effect and or maintain physical activity. Or maintain social interaction. So we go in there, we offer one-on-ones, we assess, we learn what they're interested in, and we offer interventions based on their interests, whether it's video games, board games, exercising. We get real creative with their interventions. We do have a kid who only likes video games. We like to find ways to, yeah, okay, let's find a video game, but one that's active. So we'll do a boxing game. If we have a kid who only likes coloring or playing board games, playing Uno, we'll incorporate a exercise in between. Okay, so anytime you drop a wild card on Uno, we're gonna stop and do an exercise. So we accommodate, we meet them halfway. We do offer the activities that they enjoy, but we also make sure that we are working towards our given goal from the physician. Other reasons to have individual interventions is when we are working or collaborating with the other departments like OT, PT, and dietary. When a kid is here for weight management or for increased strength and endurance because they probably had surgery 3 months ago and they haven't been able to regain strength or abilities to move like they want to move. So they come back for intensive therapies. Or they want to increase their physical activity because they haven't been active since the surgery. So they get admitted for those, intensive therapies, weight management, whether it's increase or decrease. And so PT helps with a body part. So for example, right now, we're working with a kiddo. PT is helping the kiddo get back on his feet. So PT gets with them and they work on lower body exercising and being able to walk again. He is a little overweight, so we want to also help manage his weight. So dietary, seeing him to work on nutrition. PT, seeing him to work on lower body strength to get him walking again. OT is seeing him to help him be independent with his daily activities, such as transferring from his chair to the toilet, taking showers. He came here, he was a very heavy set boy, and my job was to help with weight management and education for health and fitness. So what I did while PT and dietary and OT were doing their part, I saw him twice a week and we worked on upper body. And I showed him how to create a workout plan, how to test his abilities, what he's able to do with his upper body and how much weight can he lift, how many reps can he do, how many sets can he do. And I teach him on how to listen to his body. But being a recreation therapist, also I educate him on how to balance that a workout routine with his lifestyle. So when he's working on his therapies, I remind him like, hey, it's great that you're doing your therapies and you're working on your weight management, but you want to incorporate a healthy routine, one that you look forward to, one that you're not dragging your feet saying, oh, I have to go do this workout. So when I meet with him, I remind him like, hey, do the things you do, but also do the things that you need to do. I'm also helping him be more independent. So I create a workout for him. I teach him how to do the workouts, and then he does them on his own. I check up on him and I ask, hey, how's it going? Are you following your programs, not just with TR, but also PT, OT, and dietary? And honestly, those kids, they do tend to connect a little better with the TR team, um, because we're not just we work on social interaction and games and having fun, so they feel comfortable with us. They think TR, they think fun, and they're kids. It makes sense. Um, so a lot of the times they feel motivated by receiving the TR services or getting pushed or encouraged by the TR team because they see us as we're friends. We're trying to help. I mean, everyone's trying to help them, but they do connect a little more with us. So us being part of that treatment team helps them. Um, and it helps their time here at Scottish Rite be a little, easier. It's already great. I think it's fantastic and they love it. Uh, but they have told us, we look forward to TR and they really value it. So those are reasons to see kiddos for individual interventions in TR. Other reasons to see in patients, it's for transition planning for kids who are about to go, move to adulthood. We usually do a transition plan with the 17, 18-year-olds. Sometimes we'll have a 20-some-year-old who's returning to finish a surgery that doctor started when they were 18 because it's it's a pediatric hospital. And we'll talk more about transitioning planning in a little bit. And then we also, again, offer community leisure resources to help them get connected to their community. Next slide. And then we have our TR outpatient care at Scottish Rite, individual interventions. So I put financial barriers here because sometimes we see kids, families like in our clinics, ambulatory care, and we say, hey, they tell me they want to learn how to play basketball, but we can't afford I-9 sports, or we can't afford the city basketball, whatnot, and we can't afford to hire a trainer or so we are a good first step to that sport or activity that they want to do. So if they have financial barriers and the only way for the kiddo to participate in physical activity is at school, and sometimes it's not just financial barriers, it can also be time restraints. It can be a single parent that has a full-time job with 5 other kids and they can't take little Johnny to basketball practice or to swim lessons. So all they have is their bodies, their homes, and their sports equipment, if any. So what I'll do is offer them one-on-one sessions. I'll say, hey, come, let's do 1, 3, maybe 6 sessions, and I'll introduce to you different activities. We'll find what you like, and we're either going to pick an activity, whether it's basketball, and then I'm gonna teach you how to train in basketball with your level of abilities and endurance and strength. And here's a handout for you to follow that routine, practice it at home, and then hopefully they gain the courage to try out for the school team, or maybe just continue doing it on their own time at home. To work on increased physical activity, weight management, or just leisure. We also see outpatients for weight management. Again, for education, we teach them about leisure. We can give them education on sports or fitness. To improve social interaction. I've had kiddos who I've worked with one-on-one because they want to participate in a team sport, but they're so shy or they're so nervous. So we'll come here and, make them feel a little more confident playing that sport. And the doctors want them to be involved in activities like sports teams, not just for physical activity, but because the doctors say they need more social interaction. They're just at home. They're an only child. They don't want to do it. They're not motivated. So they come here and we hope to improve their self-esteem, increase the motivation. We prepare them to join a team sports. That's when, improve self-esteem, motivation, and gain courage. I specifically have worked with a girl who had spina bifida, and I worked with her for about 6 months, and her goal was to make the volleyball team. And so we worked one-on-one sessions, and I taught her some volleyball drills, some exercises to strengthen her body, her back, some stretches, some warm-ups. We made it fun. She looked forward to it. And eventually, you know, when it was time for volleyball trials, she made the team. And so we were able to discharge her from TR. But I still see her, and that's just an example of how we can help them get prepared for team sports, either in the community or at school. Just like our inpatients, we also offer transitioning to adulthood to our outpatients. We do leisure planning, or we can talk about the opportunities at university recreation and clubs to help maintain that social interaction after high school. Another reason why we would see an outpatient is when they are getting discharged from PT or OT and they're now ready to independently maintain physical activity levels. So a lot of times our therapists will our physical or occupational therapists will reach out to us and say, hey, you know, I've been working with Sally for like 6 months. They're ready to discharge, but I want to make sure that she's staying active. But she doesn't want to exercise. She doesn't like the exercises that I give her. And you know, a lot of times they're not that fun. So they send them to us, and I'll call Sally. I find out what she likes, what her interests are, what her goals are, and then I'll connect her to whatever she's interested in, whether it's cheerleading, swimming, outdoor sports. And if she doesn't know, then again, I can offer her one-on-one sessions and we can explore together. And on this slide, you can see a workout plan that I've created. It's like a 2-week curriculum. You do 1 week and then you do week 2. And then I also shared 2 of the workouts. So this is a workout for a non-ambulatory kiddo who wants to learn how to start incorporating exercises into her lifestyle because she's 18 and she's ready to transition to be more independent. And she doesn't want to be in the cheerleading team anymore. So I met with her. I asked her what her goals were. She says she wants to improve her upper body strength and her core. And then I tested out what she was able to do. So I had her try out some exercises like, you know, let's test your upper body strength by giving you a 3-pound dumbbell and then a 5-pound dumbbell. I asked her, can you flex and extend your knees? Can you flex and extend your elbows? Are you able to stand up independently? Do you need assistance? So based on all those observations and assessments, I was able to create this workout for her. And we try to make it fun. If you see down here on workout 2, I have full body cardio. I pronounce it Tabata or Tabata. I think it's pronounced Tabitha. But it's basically 8 exercises that you do. You can follow it with a song. Each exercise, you exercise for 20 seconds and you take 10 seconds off. And this can be any movement. So if there's only 4 things you can do, and that's clap your hands, snap your fingers, move your neck, and do shoulder shrugs, then we're going to repeat those 4 moves twice to make 8 exercises. And I really like Tabata because it can be adapted in any way. And again, it can be any movement that you're able to do. And you can start really slow and then progressively increase the workout, the reps, the sets, the weights, the tempo. So that one's a really good example. And what we are doing, I am incorporating like these workout routines for our kiddos, and I'm helping them transition into like being more independent. Again, I advocate for a healthy life, school, work balance. I don't ever want them to feel like working out is like a job or something that I have to do and I hate it. If having a workout routine does not work for you, then we're gonna find something else. If it's not volleyball, then we're gonna find something else. If it's not swimming, okay. I'm happy with you going outside, you know, walking your dog, taking strolls with your parents, finding that activity that's going to help them maintain it, something that like they look forward to, so it doesn't seem like it's like a homework assignment. Okay, next slide. So TR patient care at Scottish Rite continuous. So this is, if you see the basketball drills practice little routine that I have made, I use this a lot. I had created this for I created this for Camp TLC. It's a spina bifida camp, and I offered a basketball project where I taught the kids the basics of basketball. dribble, how to shoot, the rules of basketball. There's different rules in ambulatory basketball and wheelchair basketball. So we talked about those two. But this is just a nice little template that I made for them. I have the warm up and then I have the drills. We did this every day. And then I made them copies of this template and they took it home. So I'm in hopes that they continue to practice the sport. For some of them, it was an introduction to basketball. The feedback that I got from them, I had like about 12 kids in this project. They all loved it. And at the end, they were able to keep the basketball that they trained with, so that was very neat. Just fun fact, our team was Team Wobies or Kobe on wheels. So wheels, Kobe, Wobies. They got really creative. And then on the right side, you see a calendar. We offer a fitness calendar in a therapeutic recreation department, and it's really neat because it helps the kids stay accountable of their activities, whether it's gardening, walking the dog, doing PE at school, doing the exercise that I gave them. So if they worked out on Monday the 1st, and then we write down the activity and how much time they spent. And this is good for anybody. If you're trying to work on a new goal, studies have shown that if you write it down and if you're able to see it, it's more realistic, it's more real to you, and you're more motivated to continue doing it. And a lot of the times when you're starting something new, being consistent and having accountability helps you maintain that, accountability and being able to work towards the goal that you're still working. So this fitness calendar has been very helpful. More to our patient care. So we do offer adaptive bike evaluations here at Scottish Rite. I love the bikes. And if you don't know, there's different bikes that you can offer for individuals with different needs, different abilities. So there's if you see this one right here, the first one under Amtrak. Oops, sorry, go back. Don't look, close your eyes. Okay, the first one, this is the foot trike. The little girl in the purple, it's also a foot trike. They have seat belts. They have pedals, straps on their feet, and they have a steering kit. You see the little stick in the back, the parents or whoever can push and steer for them. So this is the perfect beginner bikes for someone who either lacks strength or is learning to walk or is recovering from surgery, or even someone who has a cognitive delay who struggles with attention span. This would be a great starter bike. This is also a foot trike. And then if you look at the end over here, these two with the helmets, the last one is a recumbent foot trike. This one right here, when the lady in the red with the red helmet, that's a hand trike. So you can use a bike using just your hands. And her feet are strapped down here, so they're stable. She has a seatbelt around her legs. Sometimes you can have one around your chest or the belly. And you push both hands forward at the same time to pedal. So again, you're using the bike, but with your hands. There's also a bike that's for hand and feet. So if you're just pedaling with your hands and your feet are strapped on, your feet are also moving. They're flexing, extending, or if you're just moving with your feet, your hands are also flexing and extending. And that one's great for someone who's trying to work on that motion of flexing and extending the knees, the elbows. So I really like that, the hand and foot trike. The goal is always to have the kids find their way to a foot trike or a standard bike. And I don't think they need to, but these kids, they want to. They want to be able to use a standard bike. They say like, hey, I want to look like my friends. I want to do what they're doing. So when we are using these bikes, we remind them like, hey, everyone starts somewhere. You are able to use this bike and we'll work to where you can go if you get there. But right now, let's focus on what you're able to do. So again, being healthy, healthy mindset with the abilities that we're able to do and not moving forward too soon. This brand, you can find different adaptive bikes, but the brand that we use here at Scottish Rite is called Amtrikes. And we assess them here. We fill out an application and we turn it into a chapter, an organization they'll call AMBUCS. It's a nonprofit community service organization. They have over 150 chapters nationwide, and they donate these bikes to our kids. All they need is a assessment completed by a therapist. You need to be a testing site. We are a testing site here. The families are able to donate money to the bikes if they can. But the AMBUCS people, they're amazing. They order the bikes from overseas, they build them, they come in a box, and then they call the families. They have a giveaway event, they give out lunch, and they say, here's the bike, let's take some pictures, congratulations, we were happy to help. So just a huge shout out to them, AMBUCS. There's also standard bikes with fat wheels. If you see this picture right here, oops, going back again. I always call them, they're like training wheels, but cooler. I tell the kids that because the kids don't want to be seen in training wheels. The 12, the 13-year-olds are like, I don't want a bike because I don't want a training wheels and I can't use it without the training wheels. So we introduce these cool training wheels, and we call them fat wheels. And I say, and they look at these bikes and they say, oh, that's actually really neat. So it's just a standard bike with these training wheels. And there's small fat wheels for smaller bikes or large fat wheels for adult size bikes. And these bikes are awesome for individuals with physical or cognitive delays. More TR patient care at Scottish Rite. So here, community leisure resources. So when we see a kid in clinic, for example, and we assess them, I go, hi, my name's Karla, I'm a therapeutic recreation specialist. This is what I can do for you. Are you interested? They say yes. They may not, a lot of the times they don't need TR interventions. All they really need is to be connected to community because they don't know that there's opportunities out there for them. They're surprised. They're like, oh, there's a team for my kid who can't really run, but can walk some, for my kid who's in a wheelchair, or for my kid who's autistic, or my kid who's not nonverbal. Yes, absolutely. We just gotta, do some research and we'll find them. Sometimes they do live in the middle of nowhere. Texas is huge with a lot of, country and open roads. If that's the case, we like to connect them with like virtual places where they can do stuff via the computer. Or we send them home with some sports equipment, basketballs, volleyballs, or even a workout plan. Or I may offer telehealth visits. But here are some resources that we tend to use, and these are all in the DFW area. And you guys might actually be familiar. You might be familiar with some of these. So of course we have Rice Adaptive Sports. It offers inclusive adaptive recreational sports programs. There's adaptive tennis. We use the Dallas Wheelchair Tennis Club, the Dallas Tennis Education Academy. And if you look at the picture on the right, this is one of our community outreach programs, Tennis All-Stars, and our partners are Dallas Wheelchair Tennis Clubs and the Dallas Tennis Education Academy. This one coach, and then our Scottish Rite volunteers. Sonny's the coach here, Coach Frank, these are all coaches, and then you have our TR team right here. But yeah, I'll tell you a little bit more about that on the next slide. But there's also adaptive dance. There's Jasmine's Beat, Anita's dance class. They offer dance classes for seated participants or cognitive delayed participants. It's open for all abilities. Sports, we have recreational or adaptive. I like I9. I9 offers basketball, volleyball, I think soccer, and I like them for two reasons. Number one, they offer a 30-minute practice before the games, and they're all on Saturdays. And a lot of our families are really busy during the week because, they have work and they have to commute, and Dallas is huge. I9 offers the sport on Saturdays, and they have practice before the game, so they would only have to make that drive one time out of the week. Also, it's a recreational sport, which means that every kid gets equal play. It doesn't matter whether you're the best, whether you're the worst, you're going to get the same amount of play as every other kid. And I witnessed I9 myself. My kids participate in I9, and they do work with kids who have, some disabilities. Very friendly. So far, I've experienced Midlothian, Waxahachie, and Mansfield. I've been in that area. They've all been great. And then there's the Dallas Junior Wheelchair Mavericks, Challenge Athletes Foundation, or CAF for sports programs. The YMCA of Metropolitan Dallas. There's rock climbing, United Rocks. Rock climbing, United Rocks is really neat. It's free, the first session, and then after that, they're going to work with you for financial reasons. And it's for anybody, and I think it's ran by occupational therapists, so that one's really neat. There's my martial arts at DFW. It offers adaptive lessons and golf. One of our partners that we partner with, First Tee. Then there's Coach Art. It's free virtual art and athletic lessons. This one's a huge one that we like to give our families, especially for those who can't commute, have financial resources. They offer like cooking classes, martial arts, yoga, in their live sessions. So you can go ahead of the class, choose what class you want to attend. You register and then you log in, and you have other kids online with you. So it's a live session with other members plus the teacher. It's really neat. There's also the Spina Bifida Association of North Texas. That's really good for support for individuals with spina bifida. They also have a camp. They have activities all throughout the year. Walk and roll is coming up in September. And then there's Adaptive Swimming. Sensational Swim School is a company that offers swim lessons at your home or wherever you want to meet. There's Aqua Tots, and again, the YMCA Metropolitan in Dallas.
Hi, Karla. Sorry to cut you off here. In the interest of time,
Okay.
can we actually cut to questions? I think we have time for one or two of them.
Oh, yes.
Thank you so much.
You're welcome.
So I'm going to open up the floor now for questions. If you guys want to unmute yourself or just send me a chat, I can read out that question to Karla.
Hey Karla, great talk. It's Donald. Just a quick question. Do you know, I know you work at Scottish Rite, so you went over a lot of the resources for kids, but if from like an outpatient side, kids or adults, what's the easiest way for us to get them into like outpatient therapeutic rec?
So outside of Scottish Rite, there's contract TR, and I always tell our patients, is that what you mean, like outside of Scottish Rite?
Yeah, outside,
I could
or
get you.
just going straight from an outpatient clinic to establishing care for children and adults, with an outpatient therapeutic rec program.
Okay, yeah, so there are therapeutic recreation specialists that do contract work. And I think the best way to find one is to call their insurance and find out, like if you're needing a dentist or a doctor or physician, that's how you would find out. You go to your insurance and say, hey, who's covered under your insurance? Same thing, call insurance, ask about therapeutic recreation services. They'll connect them with some companies. And contract TR, what they do is they either go to your home or they meet you somewhere, and the recreation therapist will take you to the park, to the playground, to the water park, or offer services at their homes.
Perfect. Okay, great. Thanks.
You're welcome.
Hey, Karla. Thanks for the presentation. I thought that was really great. And I think what you do is really cool. I jumped on a little late, so I might have missed this, but I think you mentioned the clinics. I'm just kind of curious if you could just give me a very, very brief overview of how that works.
Yeah, so there are different clinics. It really depends on the diagnosis. So I'll go specifically with the diagnosis that I work with. I work at the spina bifida clinic. That's the population that I work with within our department. Kids who have spina bifida, they see our spina bifida physicians for follow-up visits, whether it's every 6 months, once a year, or sooner. When they come for those follow-ups, we take those opportunities to go and visit them. So while the physician's not in there, we kind of sneak in there in the rooms and say, hey, my name's Karla, I do TR. Can I offer you some TR services? And then that's how we establish that relationship. And then we stick with them until they've discovered what they want to do with recreational leisure services, or they've discharged from Scottish Rite. Does that answer the question?
Yes, thank you.
You're welcome.
All right. Thank you again, Karla, for that wonderful talk. I'm so sorry I had to cut you off early there.
It's
There's a
okay.
lot of information. That was great to hear. Thank you everyone for joining. Hope everyone has a great night.
Thank you, Elizabeth. It was a pleasure.
Bye. Thank you.
Bye.
Thank you.